Many people wonder if kissing can spread hepatitis. It's a good question. This concern is valid because hepatitis is a serious health issue that affects many people worldwide. Hepatitis is a serious liver infection that can have long-lasting effects on your health. It can cause symptoms like fatigue, jaundice, and even severe liver damage if not treated properly. There are three main types of hepatitis A, B, and C. Each type spreads differently and has its own set of risks and complications. Let's take a closer look at each type and see how risky kissing really is when it comes to spreading these infections. It's important to remember that our bodies have natural defenses to fight off infections, including our immune system. Saliva actually has some amazing germ-fighting properties that help protect us from many pathogens. Plus, our skin acts as a barrier to many viruses, adding another layer of protection. While the risk of getting hepatitis from kissing is generally low, it's not entirely impossible. That's why it's still important to be informed and take necessary precautions. Knowing the facts can help you stay healthy and enjoy life to the fullest. By understanding the risks, you can make better decisions for your health and well-being. Hepatitis A is usually spread through contaminated food or water. It can also spread through close contact with someone who has it. This includes sharing utensils or touching surfaces with traces of fecal matter. But what about kissing? The good news is hepatitis. A transmission through kissing is very rare. For it to happen, there would need to be fecal-oral contact. Basically, tiny particles of fecal matter from an infected person would have to get into the mouth of another person. While possible, it's highly unlikely to happen through kissing. Hepatitis B is different from many other viruses. It's primarily spread through blood and other body fluids, making it a bit more complex. This includes not just blood, but also semen, vaginal fluids, and yes, even saliva. However, there's a catch. For hepatitis B to be transmitted through saliva, both individuals need to have open sores in their mouths, which is not very common. This is because the virus requires a direct route to enter the bloodstream to cause an infection. A small cut or sore in the mouth could provide that entry point, making it easier for the virus to spread. The risk of contracting hepatitis B from kissing someone without open sores is extremely low, almost negligible. If you're concerned about your risk, it's always a good idea to talk to your doctor about the hepatitis B vaccine. It's the best and most effective way to protect yourself and ensure you stay healthy. Section 4. Hepatitis C. Kissing is not a likely culprit. Hepatitis C is primarily spread through blood-to-blood contact. This usually happens through sharing needles or other equipment used to inject drugs. It can also be passed from mother to baby during childbirth. Kissing is not considered a risk factor for hepatitis C transmission. The virus is not present in saliva in high enough quantities to pose a threat. While it's theoretically possible for hepatitis C to spread through open sores in the mouth, it's extremely rare. Section 5. Managing hepatitis, treatment and support. If you think you might have hepatitis, see a doctor right away. Early diagnosis and treatment are essential. Treatment varies depending on the type of hepatitis you have. For hepatitis A, rest and fluids are often enough. Hepatitis B and C may require antiviral medications. Your doctor will create a treatment plan tailored to your needs. Remember, there is hope. With proper care and management, many people with hepatitis can live long, healthy lives. Section 6. Staying safe, practical tips for healthy relationships. Building and maintaining healthy relationships is essential for overall well-being. The best way to avoid hepatitis is to practice safe behaviors. This includes being mindful of hygiene and taking preventive measures. Wash your hands frequently, especially after using the restroom and before eating. Proper hand washing can significantly reduce the risk of infection. Don't share personal items like toothbrushes or razors. These items can easily transfer viruses and bacteria. If you're sexually active, use condoms to protect yourself from all sexually transmitted infections. Consistent use of protection is key. If you're concerned about your risk for hepatitis, talk to your doctor. They can provide personalized advice based on your health history. They can answer your questions and recommend any necessary testing or vaccinations. Remember, knowledge is power. Staying informed helps you make better health choices. By understanding the facts about hepatitis, you can make informed decisions to protect yourself and your loved ones. Educate yourself and those around you to create a safer environment.